Hello everyone, my viewers and my dear students. I Dr. Megha Choudhary welcome you all in my surgery online class. So we have done with the topic tetanus, and students oftenly get confused with the term tetanus with tetany. So this both are totally different, and tetanus was the infectious condition where the infection has occurred due to the bacterium Clostridium tetani, and this is a condition wherein there is hyperexcitability of peripheral nerves. It is an involuntary contraction of muscles which may be caused by disease or other conditions that increase the action potential frequency. It is a disorder of muscular and skeletal system. Tetany or tetany seizure is a medical sign consisting of the involuntary contractions of muscles which may be caused by disease or other conditions that increase the action potential frequency of muscle cells or the nerves that innervate them. There are various causes of tetany, including hypoparathyroidism, severe respiratory alkalosis, osteomalacia, and rickets due to deficiency of vitamin D, hypokalemic alkalosis of pyloric stenosis. The possible cause is hypoparathyroidism. The hypoparathyroidism is decreased function of the parathyroid glands with underproduction of calcium. Tetany can be the result of an electrolyte imbalance. Most often it's a dramatically low calcium level, also known as hypocalcemia. Tetany can also be caused by magnesium deficiency or too little potassium. Having too much acid, that is acidosis, or too much alkali, that is alkalosis in the body can also result in tetany. Now, as we all know that parathyroid gland secretes hormone PTH, that is parathyroid hormone, helps in metabolism of calcium level inside our body. Now in conditions like hypoparathyroidism or after subtotal thyroidectomy, there is low secretions of calcium. Now what are the causes for hypocalcemia? When there is inadequate intake of calcium, impaired absorption of the calcium, increased excretion of the calcium, magnesium deficiency, and the conditions like acute pancreatitis. Other causes are diarrhea when the excretion of calcium occurs, kidney diseases, thyroid or pancreas problems, pregnancy and breastfeeding, malnutrition, vitamin D deficiency. Some medications also alter the calcium metabolism and absorption, and the basic reason is calcium deficiency, that is insufficient intake of calcium. Now the three hormones, the PTH, that is parathyroid hormone, calcitonin, and calcitriol. These three hormones helps in the metabolism, absorption of the calcium. When there is low level of calcium in the serum, then PTH mobilizes the calcium from the bones. And the three organs, gut, bone, and kidney also plays vital role in the metabolism of calcium. Now what is the function of calcium? It helps in the formation of bone and teeth, nerve conduction, muscle contraction, and helps in activation of enzymes and secretion of hormones. Also helps in blood coagulation. Now in acute hypocalcemia, the clinical features can be seen as convulsions, laryngeal stridor, muscle cramps, paresthesias of the lip and extremities, and the main clinical features is tetany. Now what are the symptoms in case of tetany? In case of non-severe tetany, there is abdominal pain, chronic diarrhea, muscle pain, tingling in hands or feet, twitching of the fingers. In severe tetany, there is loss of muscle coordination, loss or change in vision, paralysis, seizures, slurred speech, cramps, sudden difficulty with memory, thinking, talking, writing or reading, sudden weakness or numbness on one side. There may be carpopedal spasm. Spasm of the intraocular muscles result in blurring of vision. Convulsions, even though rare, can occur in infants. A stridor is a dangerous complication of severe tetany due to spasm of muscles of respiration. In case of hyperventilation, there is removal of too much of CO2 resulting in respiratory alkalosis, where hydrogen is low and increased pH. Increases calcium proteinate and lowers free calcium. This causes increased excitability and further causes spontaneous tingling in fingers and toes due to increased sensitivity in the motor axons and peripheral nerves. Latent tetany can be diagnosed by applying two methods. The first is Trosser sign, when a blood pressure cuff is applied to the arm and is inflated above the systolic pressure 200 mm of Hg, and the hand will goes into the spasm. The second way is by tapping the facial nerve at the angle of jaw. This produces twitching of the eyelids, corners of the mouth, etc. It is called Chauvistic sign. It indicates facial nerve hyperexcitability. Management of tetany depends on underlying cause and severity. Mild asymptomatic cases often get corrected by increasing dietary calcium by 1000 mg per day. Symptomatic tetany need to treat immediately by oral calcium such as calcium lactate and calcium gluconate. In acute cases, injection calcium gluconate should be given slowly intravenously.